There you are. I'm so glad you came back for more. This is the YouTube channel that I like to call Menopause University. And it's where I teach you everything you need to know in order to manage your menopause your way. This is video number 298. It is part of a big unit on the 3 big diseases caused by estrogen deficiency. They are heart attack, osteoporosis, and Alzheimer's. And you know I've already given you an individual huge unit on each one separately, and now we're looking at them together. Now the reason it's important to look at them together is because they play such a huge role in the lives of women once they become postmenopausal. They are all due to loss of estrogen at postmenopause. But despite the fact that these 3 diseases are the most important aspects of menopause, there are many paradoxical things that loom over them in terms of you're getting the information you need in order to take them into account when you assess your management options. Because there is so much denial of menopause and fear of HRT, women are not getting the whole story or a balanced presentation of both the benefits and the risks of their options. Instead, most things in the world of menopause management these days amount to boxes and boxes of paradoxes. So today I'll talk about all the things that constitute paradoxes of the 3 big diseases due to estrogen deficiency. This video is super important because it gives you the big picture of the 3 diseases. In my book, I address these things separately in the individual chapters on each disease, whether or not you have the first edition or the second edition. But this video will really put things into perspective in a way that cuts to the chase and helps you decide what's best for you. So let's start with the first paradox, which is the fact that there are diseases that are a direct and undeniable consequence of losing your estrogen at postmenopause. Have you ever heard anybody talk about them in the context of menopause? Or am I the first person who has taught you that diseases are a consequence of estrogen deficiency, just like kidney failure is a consequence of insulin deficiency, and a coma is a consequence of thyroid hormone deficiency? I mean, if every woman on planet Earth is going to eventually and inevitably lose her estrogen at postmenopause, don't you think they have the right to know that these 3 diseases are a consequence of that? Well, the paradox is that here you have 3 deadly diseases that are a consequence of estrogen deficiency, and yet women don't even know there are diseases that are a consequence of estrogen deficiency. Diabetics know that blindness, kidney failure, non-healing sores, amputated limbs, and death are a consequence of insulin deficiency. Why don't women know about that heart attack, osteoporosis, and Alzheimer's are a consequence of estrogen deficiency? People who have thyroid hormone deficiency know that coma, heart failure, and heart attack, and death are a consequence of thyroid hormone deficiency. So again, why don't women know that heart attack, osteoporosis, and Alzheimer's are a consequence of estrogen deficiency? The paradox is that it just doesn't make sense to ignore all the basic principles of any hormone deficiency when talking about estrogen, but dwell on it with all other hormone deficiencies. The second paradox is that all 3 of these diseases are silent diseases. They all sneak up on you without producing symptoms to warn you that they're there. And when they progress to the point of making their presence known, it's too late. You don't know your heart arteries are blocked until you have a fatal heart attack. You don't know you're losing bone until you fracture your spine, hip, or wrist doing something that should never cause a fracture. And you don't know you have Alzheimer's until 40% of your brain is gone and there's no way to get it back. The paradox is that with silent diseases that women will not be able to detect themselves, you would expect all sorts of education and awareness efforts. But instead, the opposite is true. Women are induced to focus more on breast cancer than on heart attacks. Women are told to use calcium, vitamin D, and exercise to prevent osteoporosis, even though those things are incapable of doing so. And women are told that HRT is dangerous so that they do not take it to save their brains. And that creates the third paradox. Because women are clueless about the fact that these three silent diseases are a consequence of estrogen deficiency, both women and their doctors are lackadaisical about addressing them at all. Women have no idea that heart attack is the biggest risk of all at postmenopause. They are under the delusion that a good diet and weight-bearing exercise is all they need to do to prevent osteoporosis. And they ignore the brain fog that occurs at postmenopause as if it's no big deal. This lackadaisical attitude on the part of both women and doctors perpetuates the lack of awareness that is already so severe. And that leads to a great lack of educational efforts, screening tests, early intervention, and prevention of all three diseases. The paradox is that there is a lackadaisical attitude about estrogen deficiency. The fourth paradox is that even though estrogen is a hormone produced by your own body, women think it's dangerous and fear it. They view it as being more like a poison than a vital hormone. Despite the fact that estrogen is to women what testosterone is to men, and despite the fact that women feel wonderful before they lose their estrogen and feel miserable after they lose their estrogen, and despite the fact that anyone who has any other hormone deficiency would not hesitate to take hormone replacement, somehow women have been led to believe that their own estrogen is bad for them. How can something that is good for you become bad for you? When and how does that happen? The paradox is that women fear the very hormone that prevented all these deadly diseases of postmenopause in the first place. The fifth paradox is that instead of fearing these three diseases that are proven to be due to estrogen's absence, women fear one disease that has never been proven to be due to estrogen's presence: breast cancer. No study has ever shown that estrogen causes breast cancer, yet women believe that it does. And they avoid estrogen replacement because of this erroneous belief. And because they are so convinced that their fears are warranted, the entire medical profession has fallen in line with this fear. Women who have only had pre-cancers in their breasts are treated as if they've had full-blown breast cancer and they are denied estrogen. Women who have relatives with no bearing whatsoever on their risk for breast cancer forfeit estrogen replacement because someone else whose breast cancer is irrelevant to them had breast cancer? The paradox is that women who forfeit estrogen replacement because of their fear of breast cancer put themselves at very high and very real risk for heart attack, osteoporosis, and Alzheimer's instead. The sixth paradox is that deficiency of the very hormone women fear the most produces 22 symptoms that interfere with every aspect of their quality of life. Of course, no one teaches you that all 22 symptoms are due to just one thing. Instead, you have no clue that estrogen deficiency is the cause of all of them. So you spend years of your time and lots of your money going to uninformed professionals for help and buying products that can't help. And because the symptoms of estrogen deficiency are not silent like the diseases are, you focus solely on the symptoms. Of course, the symptoms can't kill you, whereas the diseases can. But no one bothers to bring that to your attention. So instead of targeting the one thing that is at the root of all 22 symptoms, you try to find ways to relieve each symptom individually. This goes back to the tree of menopause that I presented in videos 234 and 235. Women talk about hot flashes instead of heart attacks. They complain about osteoarthritis instead of osteoporosis. And they worry about menofog instead of Alzheimer's. The paradox is that estrogen deficiency causes 22 symptoms in addition to the 3 silent diseases. Do you see how we already have boxes and boxes of paradoxes and we're not even finished yet? This leads us to the 7th paradox. Because of the focus on symptoms rather than diseases, and because of the fear of estrogen replacement, the primary and secondary reasons for taking hormone replacement at menopause have been completely reversed. Instead of taking it to avoid the 3 deadly diseases, both women and doctors consider alleviating the symptoms of menopause as the primary reason to take it. Of course, this is the reverse of how it used to be before fear of HRT became rampant. You would never find a diabetic or hypothyroid person say that they take their hormone replacement to prevent symptoms as their primary reason for taking it. Preventing death would be the primary reason. Symptom relief would be secondary. Why is it any different for estrogen replacement? The paradox is that the very reason for taking hormone replacement has been turned upside down because of fear, not logic. Which brings us to the 8th paradox, risks and benefits. Instead of focusing on the benefits of taking hormone replacement when you lose your estrogen at postmenopause, both doctors and women focus on the risks. Despite the fact that everything in life has both benefits and risks, they act like HRT has only risks and no benefits. The mere idea that replacing a hormone that your own body produced could possibly be more risky than beneficial is just plain absurd. If a diabetic took insulin and still developed non-healing sores that led to amputation of a limb, you wouldn't assume that the insulin replacement caused them. You would know that a diabetic is at risk for non-healing sores anyway. If a person with a deficient thyroid hormone gained a lot of weight and had a heart attack, you wouldn't assume that the thyroid hormone replacement caused the heart attack. Instead, with both of those, you would know that the hormone replacement decreased the risks of those outcomes, and most likely, the patient wasn't taking enough of the hormone replacement. Heart attacks, stroke, blood clots, and cancers are not due solely to HRT. They all occur for a multitude of other reasons. So why do women and doctors assume that HRT causes them? With any disease, the key to management is to weigh the benefits against the risks. And with any disease, you must tailor those benefits and risks to the individual person. For the vast majority of people who need to consider any kind of treatment in the first place, the benefits of treatment greatly outweigh the risks. The paradox is that with HRT, women have been led to believe that hormone replacement is bad, period. They have been told that the risks outweigh the benefits for all women. And women have believed this primarily because no one tells them the risks of not taking HRT. Add to that the 9th paradox, which pertains to dosage and timing of HRT. The idea with any hormone replacement is to replace the missing hormone. So the dosage needs to be sufficient to do just that. And if you bother to replace a missing hormone, the goal is to prevent the deadly diseases that result in the absence of that hormone. So it makes absolutely no sense to take a dosage that falls short of preventing the diseases. With insulin replacement, you would never take less insulin than your body needs to do all the things your own insulin is supposed to do. And with thyroid hormone replacement, you would never take less thyroid hormone than your body needs to do all the things your own thyroid hormone is supposed to do. Plus, you would never stop taking a hormone replacement if your own body can no longer produce the hormone. If you did, the deadly diseases ensue. So you would take insulin and thyroid hormone for the rest of your life. The paradox is that with HRT for postmenopause, the guidelines recommend that you take the lowest dosage for the shortest time. Why in the world would you take a dosage lower than what is adequate and sufficient to prevent 3 deadly diseases? And why in the world would you stop taking it if those 3 deadly diseases would ensue when you do? Because of the irrational and illogical fear of estrogen and HRT, even the guidelines for postmenopausal hormone replacement have been distorted in ways that make absolutely no sense at all. The 10th paradox is that the medical profession has perpetuated the fear and denied women estrogen replacement. This is the industry that is supposed to help you prevent deadly diseases. And instead of giving you the very hormone that can prevent these 3 deadly diseases, they are increasing your risks for all of them by withholding it. You know, every doctor swears to do no harm. But doing no harm can consist of doing something or not doing something. And if the perception is that it's harmful to start HRT once you're postmenopausal, why not just start it when you're perimenopausal? I mean, think about it. That would bridge the gap between the time you lose your own estrogen and the time you start replacing it. And it would be very early in the transition into menopause when most women are still very healthy and have few or no risks of taking HRT. And it would prevent the 3 big diseases from the get-go, as they say. But withholding a hormone replacement in the face of a hormone deficiency is doing harm. No doctor would withhold insulin or thyroid hormone, so why is it different for estrogen replacement? Well, the paradox is that doctors withhold HRT because they are afraid of litigation. With women fearing estrogen and HRT so much, doctors feel that they will get sued by any woman on HRT who ends up with any disease whatsoever. Instead of educating women about both the benefits and the risks, and explaining that HRT is hormone replacement for a hormone deficiency just like any other hormone deficiency, doctors scare women with the risks so that they won't want HRT. So the paradox is that doctors are doing what's best for themselves rather than doing what's best for their patients. That's the opposite of do no harm. It is a case of the doctor doing what is in his or her best legal interest versus doing what's in your best medical interest. Now, I have nothing against doctors or lawyers. In fact, I have both a medical degree and a law degree. I'm a doctor and a lawyer. So I understand this from both sides. But you don't, and you shouldn't. You should care about you, and you should focus on what's best for you. And your menopause management should be consistent with your comfort zone and health benefits, not with your doctor's comfort zone and legal benefits. The paradox is that doctors are doing what's best for themselves instead of what's best for their patients. The 11th paradox has to do with how all this fear came about in the first place. The infamous WHI study. Instead of studying HRT's ability to relieve your symptoms of menopause, it studied HRT's ability to prevent these 3 big diseases. But it was a corrupt study from the get-go. It refuted everything all previous studies had shown, and the reporting of it to the public scared women away from using HRT for any purpose. And despite the fact that one study is never the Bible and does not invalidate all other studies, that is how this one study was utilized. And this one study is what turned the primary and secondary reasons for taking HRT upside down. But it scared everybody so much that it exaggerated the findings to imply that HRT had more risks than benefits for all purposes. That is not true. And even though the WHI has been reanalyzed over and over again since then, and even though we've discovered that it was terribly flawed and misleading, no one ever informed you of that. The paradox is that one study that disagreed with all the others is the one everybody decided to honor the most, despite the fact that it was the most distorted study ever done. And now we come to the 12th paradox, which is also related to WHI. The main objective of the WHI was to determine if HRT prevented heart attacks. Well, guess what kind of physician was the lead investigator of the entire study? A cardiologist, whose bread and butter is, what do you know, heart attacks. Do you really think any cardiologist wants women to know that simply taking HRT will decrease the risk of heart attacks? I mean, in an honest world, the answer would be yes. But, my dears, this is not an honest world. And the truth is that no cardiologist wants you to know that HRT will prevent heart attacks if you start it early in your postmenopause. And every cardiologist will try to scare you into stopping HRT if you're on it. They don't know much about HRT. All they know is what they heard from the media, just like you. And they certainly don't want their bread and butter to disappear. So cardiologists push statins, not HRT. Ironically, statins appeared at the same time that HRT disappeared. The paradox is that the very kind of physician who should want to prevent heart attacks is the kind who is keeping you from doing so. And finally, we have the 13th paradox, which pertains to all the non-hormonal means of preventing the three big diseases, or as I sometimes say, diseases. Just because women and doctors fear estrogen and HRT does not mean they should ignore the three big diseases altogether. Why aren't doctors discussing these three big diseases with their female patients in the context of how to prevent them without HRT? Why aren't they discussing all the dietary, lifestyle, supplement, and non-hormonal medications that can decrease your risk? Most women say that their doctors never even bring up the topic of heart attack, osteoporosis, or Alzheimer's as a part of the conversation on menopause. Instead, they focus on symptoms. And they offer antidepressants, lubricants, and supplements for things that these options cannot fix. Instead of telling you that all your symptoms are due to estrogen deficiency, they make you feel inadequate if you can't tolerate the symptoms. Or they make you feel like you're crazy because you have so many different kinds of symptoms. It's atrocious. The paradox is that instead of having the conversation and making sure you know all your options, benefits, and risks, doctors are trying to put a temporary Band-Aid on superficial symptoms rather than avoiding deadly diseases. If you ask me, it all adds up to boxes and boxes of pitiful paradoxes. With this education I'm giving you, you'll have all the facts and all the tools to manage your menopause your way without falling prey to box after box of paradox upon paradox. So here's the whole list of paradoxes. 1. There is ignorance of the basic principle that any hormone deficiency causes disease. 2. The diseases of estrogen deficiency are silent diseases. 3. There is a lackadaisical attitude about estrogen deficiency. 4. Women fear the very hormone that prevented the deadly diseases of postmenopause. 5. Women who forfeit HRT because of fear of breast cancer put themselves at high risk for the three diseases due to estrogen deficiency. 6. Deficiency of the very hormone women fear causes 22 symptoms and 3 deadly diseases. 7. The primary and secondary reasons for taking HRT have been turned upside down because of fear, not logic. 8. With HRT, women have been led to believe that hormone replacement is bad. 9. With HRT for postmenopause, the guidelines state, take the lowest dosage for the shortest time. 10. Doctors are doing what's best for themselves instead of what's best for their patients. 11. The one worst study that disagreed with all the others is the one everybody chose to honor the most. 12. The very kind of physician, cardiologist, who should want to prevent heart attacks the most are the kind who are keeping women from doing so. 13. Instead of making sure you know all your options, benefits, and risks, doctors offer temporary band-aids on superficial symptoms rather than avoiding deadly diseases. Like I said, it amounts to boxes and boxes of paradoxes. I'd better stop now before I blow a gasket. I hope you can see how passionate I am about making sure you know how to manage your menopause in a way that really makes you happy with your management style. Just be sure to either watch the videos in order starting with video number 1, or watch the 15 webinars in order starting with webinar number 1, or read my book in order starting with page 1, or schedule a consultation with me so that I can give you the information you need to tailor everything specifically to you. Do not settle for a paradoxical postmenopause that faces you with deadly diseases that you could have avoided. So this is where I'll stop today. Be sure to come back next week. Schedule a consultation at menopausetailor.me so that I can meet you and help you, and you know that you don't need hormone studies for a consultation. Follow me on Facebook, Twitter, and Instagram, and please subscribe. Bye!